some of you have joined my last session as well, and for some of you, this might be the first session. Just a quick recap on what we did in the last session. Okay, we studied about the basic things, lifestyle disorders, and what is diabetes, type 2 diabetes specifically. I have touched base upon the type 1 as well, but we stick to the type 2 during all the sessions. Wherever I need to touch base upon the type 1, I will do that, but most of the time we will touch base the type 2 diabetes, which is a lifestyle disorder. We studied about that, what are lifestyle disorders. Okay, we studied about what is insulin sensitivity. We studied about insulin resistance. Okay, this is something which we are going to talk about today as well, and trying to understand the major factor that what causes insulin resistance, which is your obesity. Okay, then we studied about hyperinsulinemia, that what is hyperinsulinemia, and is hyperinsulinemia equal to type 2 diabetes or not. We studied that, and then we studied that how hyperinsulinemia leads to type 2 diabetes. Okay, this is something which we covered in the last session. Today, the topic of discussion will revolve around obesity. Okay. Today, we will talk about obesity. Today, we will talk about visceral fat, subcutaneous fat, which is basically type of fat distribution in the body, and how it actually impacts your lifestyle disorders and how obesity is actually causing all these issues. Okay. So, let's start with the discussion for today. Okay. In the obesity, before I start with the discussion, the majority of the people understand that obesity obviously lead to multiple health issues. It obviously lead to multiple health disorders. Okay. But can we say that a person who is lean, okay, understand the question and then only answer. Can we say a person who is lean, who is not actually obese or overweight, can have lifestyle disorder? Can we say that? Or a person who is lean cannot have a lifestyle disorder? Quick yes or no? What's your understanding on the
Yes,
same?
sir, he can have it.
Yes,
He
yes,
can have it.
yes, sir.
He can have it. Okay, fine. Today we will understand that how a lean person can also have a lifestyle disorder. Okay. I have currently multiple clients who are into the weight range of 55, 60, between 50 to 55 as well, but has uncontrolled diabetes. Today we will discuss a little bit about that how a lean person can also have a diabetes or a dyslipidemia, which is basically disturbed cholesterol levels. First of all, let's understand that how do we define obesity, or to what particular person we call that a person is obese. Every one of us knows about BMI. Okay, that what is BMI. We will touch base upon the BMI and your BMR and all these terms later as well in the subsequent sessions. Today we are sticking only to the basic definition of obesity, that what is BMI. A person who has a BMI of more than 25 kg per meter square is known as overweight. That person is basically not your obese person. A person having more than or equal to 25 your BMI is called overweight. A person more than 30 of your BMI is called obese. Okay, a person having a BMI of more than 30 is called obese, and there are three classifications of obesity: type 1, type 2, type 3. Irrelevant to discuss, so not going into the detail, but just for your clear understanding, more than 30 is BMI, that person is called obese. More than 25 up to 30, that person is called overweight. Okay. Now, what we understand by obesity and why we are studying it, basically obesity in itself is a cluster of diseases. Okay. Obesity is actually considered in itself as a disease because it is happening because of your lifestyle. We studied this thing in the last session, that what is a lifestyle disorder, right? And how our lifestyle impacts our routine and it impacts our health. Obesity also comes out of your lifestyle. There are multiple reasons a person can be obese. Okay. Obviously, lifestyle is one of the things. There is some of the studies not some, actually majority of the studies have shown that it is also genetically pre-imposed. Okay, genetics also play an important role in obesity. For the usually in a general setting, you will see usually the parents who are basically on the higher side of the scale, you will see that their kids are also a little bit on the higher side. Okay, because obesity also is also like diabetes or cholesterol, it runs in the family. So there are certain genetic predispositions as well for obesity. Other than that, obviously there are lifestyle issues. We will be sticking our discussion around the lifestyle issues, that what are the lifestyle issues which are basically causing obesity. We are not talking about the genetic issue, because something which is not under our control, it is irrelevant for us to discuss right now. But again, understand one thing. A person who has a genetic predisposition does not mean that that person will be obese even if the lifestyle is good. If a person is improving on his lifestyle, and many studies have proven this thing, a person can improve his obesity levels, his health markers, even if there is a genetic predisposition, by changing his or her lifestyle. Okay. Now coming to the complication, that what actually obesity does. Okay, what are the different kind of lifestyles? Some of the lifestyle disorders we already know that what diabetes, what obesity can cause, but there are certain you might not be knowing, but again they are the one which are caused by your obesity. Okay, I'm going to write few here. I'm expecting you guys to just quickly tell me what are the lifestyle disorders you think can happen because of obesity. Just put it in the comment section once. Okay, let's pick out the common one first of all. CVD. CVD are your cardiovascular diseases. Okay, your cardiovascular diseases is basically something which is happening because of obesity. Okay, diabetes. Cardiovascular means something related to heart. Your blood pressure is high, there is a blockage in your arteries. Okay, then there is a stroke which is happening because of the CVD. Diabetes, we are talking here about type 2 diabetes. Okay, we already know about insulin resistance and everything which is happening because of obesity. Then thyroid, PCOD, polycystic ovary disorder. Okay, PCOD and PCOS, polycystic ovary syndrome. Fine. Apart from this, what else you think it can happen? High cholesterol. Yes. Dyslipidemia. Dyslipidemia means that the lipid means basically the fat, that the lipid concentration in the body is not correct. Dyslipidemia means lipid concentration is not correct. That is your cholesterol. Okay. Cancer. Yes. Cancer can happen also because of obesity. Arthritis. Early age arthritis happens. Old age arthritis is another thing. Early age arthritis also happen. At the age of 30-35, people start getting arthritis because of obesity. Have you ever heard of the term GERD? GERD. Gastrointestinal reflux disease. Gastroesophageal, not the intestinal, sorry. Gastroesophageal reflux disease. Acid reflux, which happens again because of obesity. Someone mentioned infertility. Yes, low testosterone level in males because of obesity. Okay. Again, apart from this, what can be there? Heard of the term plantar fasciitis? Yes, can happen because of obesity. Sleep apnea. It's a very common issue with the people who are obese. Snoring happens because of obesity. Okay, these are the common things which you come across in your daily routine. Okay, and most of these things happen because of obesity. We are not saying that these things cannot happen because of any other reason, but if a person is obese and he focus upon improving his or her lifestyle, these are the things which can definitely can improve. Okay, a lot many things goes in management of all these things, but yes, and these are just a handful. I'm telling you, there is a huge list. There is a huge list which has been proven by multiple studies that these are the disorders which can happen because of obesity. Let me see if I have mentioned something. Yes, nowadays menopause, actually yes, it's a very prominent problem right now. Early age menopause is again because of the obesity, because your hormonal levels changes. Infertility, fatty liver, yes, non-alcoholic fatty liver is actually a very common issue right now. I have clients of 25, 28-year old who have non-alcoholic fatty liver. Okay, no history of alcohol, nothing, but again have grade 2, grade 3 fatty liver, all because of the obesity. And diabetes, in the future subsequent sessions, you will understand the diabetes and non-alcoholic fatty liver, they are actually quite interlinked. Okay. High BP, high cholesterol, diabetes, thyroid. Yes, I think we have covered most of the thing, but there are certain other issues as well that we are not touch basing upon here. Okay. Even at the time of pregnancy, also there are multiple complications which can happen if the mother is basically on the higher side of the weighing scale. Okay. Again, not sure if you guys have heard of this particular syndrome. There is one syndrome which is called as metabolic syndrome. It's basically a metabolic syndrome is basically which comes under the obesity. It happens because of the obesity, and it has a certain parameters. Okay, it has a certain parameter that if you have any three of these parameters, you are basically called as a person who has a metabolic syndrome. Okay, and again it leads to the multiple issues in the body. It leads to again your diabetes, your cholesterol issues, and all those problems which we have seen in the a person who is obese. What are the conditions we usually take for the metabolic syndrome? It is your increased triglycerides, which you see in your blood report. Okay, your decreased HDL levels, your increased triglycerides level. Okay, your BP remains on the higher side. Okay, and your sugar reading, fasting sugar reading is on the higher side. If you have three of the issues out of these four, one, usually you are considered as a person who has a metabolic syndrome, and it's like a green signal that you have to start working upon your health. You start working upon your lifestyle, you start working upon your food habits, your inactivity levels, because if all these things keep on increasing, decreasing, you will start having multiple health issues. Okay, multiple health issues. So this is something which we are basically focusing upon, that how to get out of this thing. I'm not going into the very technical details. Okay, I'm not going into very too much of technical details because that is irrelevant. These sessions are not to basically this is something which is completely separate from the sessions which I used to take for coaches, because there I want them to understand in depth. Here we are just touching upon the topics which are relevant for the general population to understand that what is happening inside the body and why they need to focus upon a healthy lifestyle. Okay, so we are not going too much into detail, but stop me anywhere if if I'm missing something over here. Now, if we have touched about the metabolic syndrome, there are two terms. First of all, which I will touch base upon now, and then we will circle back to those two terms again at the end of the session, so it will be more clear to you. Okay, there are two terms. Understand. One is metabolic, metabolically obese, healthy individual. Metabolically obese, healthy individual. Remember this term. This term basically means a person is obese metabolically. If you look at the BMI, if you look at the weighing scale, if you look at the person is obese, but it's a healthy individual. Okay, metabolically healthy individual. Again, remember the term metabolically obese, healthy individual. Another one, another term is metabolically healthy obese. These two terms are different from obesity. Metabolically obese, healthy individually, metabolically healthy obese. A person who is obese, but metabolically that person is healthy. How is that possible? We'll see. Another case is a person is metabolically healthy. If you look at the BMI, if you look at the BMR, if you look at the numbers, the person looks absolutely healthy. But metabolically that person is obese. How, what, why, what are these terms? We'll come back to these again. Okay. Now we will circle back to the basic concept of how a lean person, and see again, just to give you a heads up, so that you guys can relate to the thing. Here we are talking about a lean person. A lean person who is metabolically healthy, who is not metabolically healthy, who is healthy as per the markers, but metabolically obese. We are talking here about a lean person. The question which I asked at the starting of the session. Okay. Because it's a very, why I am emphasizing a lot on the discussion here about the person who is lean. Because what happens, for example, my body does not gain fat that easily. Okay. I keep on eating, I have a bad lifestyle, I am going out for parties, I am drinking, I am not doing any activity. Considering that my body does not gain fat, I cannot have all these issues. I cannot have any of these issues with the people, overweight people have, because my body does not gain fat, so I can do whatever I want to do. I can live a very unhealthy lifestyle, but still I am good because my health markers are normal. That's why I am discussing about this lean topic again and again, because it's a very common scenario these days. Okay, I have multiple cases with me right now where a person is lean but still have multiple health issues. Okay, fine. Now let's coming to the basic concept of which some of the people mentioned over here: visceral fat and subcutaneous, and what it is actually. Before we move forward, do you guys have any doubt over here? Just let me know so that we can move forward. Any doubt? Anything you want to discuss again? You want me to repeat again? Otherwise, we'll move forward. Please confirm.
No, sir.
Okay, fine. Perfect. Now coming to the topic, obesity again. Not the obesity, we will talk about the fat. See, the fat we are talking about here is the fat which is inside our body, not the fat as a macro. Okay. We are not talking about fat as a macro, we are talking about the fat which is basically distributed inside our body. There are basically two types of fat inside our body. Okay. Understand this thing very clearly. One thing is your subcutaneous fat. Another one is your visceral fat. Okay, what's the difference between the two? We'll discuss this. I'll not go into the scientific details. I'll try to keep the discussion as simple as possible for everyone to understand. Subcutaneous fat is the one which are basically the storage space of your in your body. Okay, just imagine that this is a cupboard. Okay, it has a storage space for your clothes. It has a storage space for your clothes, and every compartment is basically already it's already defined that in this particular storage space the clothes will go, in this particular storage space the books will go, in this particular storage space that particular item will be kept. Okay, so subcutaneous fat is also the one which is basically below your skin, and these are the storage fat areas of your body. Okay, it is underlying your skin area, it directly under below your skin. Okay, and this is where the your body naturally stores fat. Okay, your body naturally stores fat. Like for example, if you see the body fat distribution of a male and a female body, you will always see a female body is usually store fat around the lower belly area, hip area, thigh area, okay, and a neck area. Usually the male body accumulates more fat around the belly area. There is not that high amount of fat, stored fat around the hips area or a thigh area. Okay, these are the natural reservoir of your fat in the body for a male and a female. This is where most of your subcutaneous fat is going and getting stored. So what happens? This subcutaneous fat which is getting stored. See, at the end of the day, after a certain limit, each and every ounce of fat which is excess in your body is going to cause multiple issues and a health markers. So it does not mean that a person who has this thing, your high amount of subcutaneous fat cannot have issue. A person who only has a visceral fat will have issue. Understand the difference, and why I'm telling you, I'll explain again. Subcutaneous fat is something which is basically the natural storage spaces of your body, where your body is basically storing the maximum amount of fat. But what happens? This particular compartment in your cupboard has a certain limit. You can store up to a limit of your fat in these storage areas. Okay. But what is happening? You keep on buying new clothes. You keep on going out for shopping. You're not discarding your old clothes. This storage space will get cluttered. Okay. This storage space will get cluttered. Where the excess clothes which you are buying will go? Into the next compartment. The next compartment is for clothes? No, that next compartment is for the additional things. Okay. But you start stuffing your clothes over here as well. What will happen? This particular stuffing of clothes in the next compartment will lead to the disturbance in the entire balance of the cupboard. Okay. It will start unnecessarily disrupting the placement of the other things in the cupboard. What is this? This next compartment of this cupboard is your visceral fat. I'm trying to explain in as simple terms as possible. Does not work. It's as simply, but yes, this is like the basics. That's how it usually happens. Your subcutaneous fat basically has a limited storage. Okay, after a certain limit, you keep on eating. You keep on eating food. You keep on staying inactive. You're not doing any activities. You're not basically focusing upon reducing your body fat percentage. After a certain limit, this subcutaneous fat storage will basically will be overpacked. They will start pushing fat cells into the vicinity. Once they will start pushing the fat cells into the vicinity, what's there in the vicinity? Your organs. Visceral basically means it's the around the organs. The space which is between your two organs is called a visceral space. It's called a visceral space in the body. This visceral fat is the one which is accumulating around your organs. Where are most of your organs located? Just quickly. Is it in the upper body, middle part of the body, lower part of the body? Where are most of your organs located? Quickly. Middle part
Middle
of the
part
body.
of the body.
Middle part of the body. So what happens? Whenever your visceral fat starts increasing, you will hear this term very frequently, abdominal obesity. It increases. Abdominal obesity. This particular part of mine is called abdomen. Okay. This particular part in a human body is called, middle part is called abdomen. Abdominal obesity increases. Why? Because my visceral fat is increasing. The fat around my organs is increasing. Why it is increasing? Because I overstuffed my subcutaneous region. I overstuffed my compartment which was actually supposed to store the body fat percentage, or the maximum body fat in my body. Now what is happening? Once these becomes overpacked over here into the around the organs area. Now this fat which is around the organs area is becoming the main culprit in the entire journey. This is becoming the main culprit in the entire journey for disturbing your health markers. Now coming to the point, that does that mean that a subcutaneous fat does not cause any of these issues? Subcutaneous fat can also cause issues, but multiple studies have proven this thing, that your visceral fat is actually more complicated, much more responsible for your health marker than your subcutaneous fat, because there is a lot of chemical reactions which are happening because of the visceral fat, which is disturbing the normal functioning of your organ. Okay. Now just imagine. Now just imagine this is my liver. Okay. And this is supposed to be functioning very normally. This is a normal functioning of a liver which is happening. Again, getting into a very layman language, not scientifically. The basis is basically the entire basis which I am explaining, how I am explaining, is scientifically, but not trying to use any of the terms. So understand it very clearly. This is like a normal liver which is there, functioning very normally. Just imagine a lot of fat cells start getting accumulated here, which is your non-alcoholic fatty liver. These fat cells start releasing certain kind of inflammation factors into the liver. What will happen? It will start disturbing this normal functioning of the liver. What will happen because of this? My liver is not functioning normally. It will impact my dyslipidemia. If you understand a little bit about the fat digestion in the body, a very major digestion of fat starts from liver. For glucose, liver acts as the storage organ. Liver plays a very important role in the management of sugar in your body. Your cholesterol levels goes for a toss. Your glucose level goes for a toss. Why? Because these fat cells which started accumulating around the liver, okay, start disturbing the normal functioning of the liver. This is what the visceral fat is doing inside the body. This is something which is they are doing along with the pancreas also. Pancreas is what? An organ which is releasing your insulin. It is disturbing your normal functioning of insulin also. They start disturbing the beta cells which are present in pancreas. They start accumulating around the muscles, your fat cells. Once they start accumulating around the muscle fibers, they start making them insulin resistance. Insulin resistance, remember the first session, insulin resistance leading to hyperinsulinemia, leading to diabetes. Okay, so these are the fat cells which are basically disturbing the normal functioning of the muscle cells, which were absolutely healthy. From where these fat cells have come? Because my subcutaneous fat was more. Now they started spilling the fat into the visceral organs. Now, why we say that the visceral fat is something which is the main culprit, and why not the subcutaneous fat? Okay, there is a very slight, not slight, actually there are multiple differences between the way that these both fat cells work. Okay, not going into that detail, but again, one simple example so that it's easy for you to understand. How the fat is getting stored between the visceral fat and the subcutaneous area, so that it's easy for you to relate to it, that why there is a spillover. If the fat cells are going into the visceral fat, why they are not getting stored over there like they're getting stored in the subcutaneous fat? There is there are basically two ways how the body stores the fat. Okay, the one term is hypertrophy, the another term is hyperplasia. Just give me a second. Hypertrophy is what? Hypertrophy and hyperplasia. Okay. The subcutaneous fat, which is there, your basically your storage space of your fat, which is the natural storage space of your fat. Okay. That basically stores fat by hyperplasia. Hyperplasia is what? For example, you have 1 liter of water with you, okay, and you have a balloon which has a capacity of 250 ml. You have 1 liter of water and you have a balloon which has a capacity of 250 ml of water. Now quickly tell me, if I will fill my 1 liter of water in 4 balloons, will that be a much more stable structure and a much more stable balloon? Or if I fill entire 1 liter somehow into one balloon, okay, which one do you think will be much more stable structure?
250 ml.
250 ml each, right?
Yes.
Now the same thing is happening inside our fat cells. Studies have shown this thing that your subcutaneous fat actually stores fat by hyperplasia. Hyperplasia means they divide the cells. Adipocytes are basically the storage space of your fat cells, your fat. Whenever your excess fat is coming inside the body, your cells keep on dividing, proliferating, and keep on making new spaces for the excess fat to come. So, and this thing happen after till a certain limit. Okay, again, this thing is happening till a certain limit, as I mentioned. Compartment की space है एक, उतनी space में जितने में fat cells accumulate कर सकते हैं, उतने तक वो divide कर रहे हैं. They are dividing it till the time they cover the entire space, but they are not expanding their size. Up to a limit, they only fill up, and after that, they start dividing and start storing it. But opposite of this is happening in hypertrophy, which is your visceral fat. How your visceral fat is accumulating fat? They are basically increasing their size. They are not dividing the number, they are increasing your size. What is happening when they are increasing your size? The structure becomes unstable. The structure becomes unstable, and that unstable structure, what will happen? This structure will start leaking, and these free fatty acids will start circulating into your blood, and these free fatty acids from the blood start going and disturbing your organs. Okay, this is what is happening because this structure was not stable. Okay, it has a certain capacity, but it is overfilled. It's like a balloon with the excess amount of water in it. The balloon will burst. Similarly, the cells are basically unstable. So they start leaking these free fatty acids into the bloodstream, and they reach up to the organs and start disturbing your normal functioning of the organs. Okay. Everyone clear till here what is visceral fat and what is subcutaneous fat?
Yes.
Hello.
Yes. Hi, Garunesh.
Hi, Dr. Aakash. So, specifically on circulating free fatty acids in the blood. So that is the reason, most of the diabetic patients or the patients those who have reached to this level are having inflamed bodies or having a more chances of inflammation.
See, obesity in itself, like fat cells, excess fat cells in itself leads to a lot of inflammation in the body. Okay. So it does not mean a person who has a diabetes will have the more inflammation. Obesity in itself leads to a lot of inflammation in the body. Okay.
Right.
So
Right.
yeah, so it in itself it releases a lot of markers which are responsible for the inflammation. And see, I was not trying to get into that detail, but just to give you a quick check on that. When this visceral fat, when they are basically dying, okay, or they are bursting, they release a lot of they actually attract a lot of immune response as well. Because just imagine there is a healthy cell and there is an unhealthy cell in your body. Your body tends to push the unhealthy cell out of the system. So there is a lot of immune response which starts happening over here. And because of that as well, there is a lot of inflammation which is happening inside the body. So it happens in an obese individual, a lot of inflammation happens.
Okay. Okay. That is the basic management for the homeostasis, which
Yes.
body is doing it.
Yes. That's it. That's your body's response basically. Okay. Fine. Any other question on visceral fat and subcutaneous fat? Move forward. Okay. Now, just let me show you a quick photograph on this. Let me know if you guys can see the screen, right? You guys can see the screen, right?
Yes.
Some issue with the photo. Sorry, I'm not able to open the photo, some issue, but you can see the image over here, right?
Yeah.
Now just look at this image. This is basically a MRI. Okay, this is just basically an MRI from the top of the body. This is just to show you the difference between the subcutaneous fat and the visceral fat. The blue color area is basically your signifies your visceral fat. The yellow color area outside is basically the one which is signifies your subcutaneous fat. Okay. Now, and I can tell you one thing, that all these three people have the same almost the same BMI. Okay, we talk a lot about BMI, right? That the BMI should be within this range, should be within that range. So all these three people have the same BMI, almost similar BMI, around 24, 25. Okay, but can anyone tell me? Do you think the top one is A, the right one is B, and the lower one is the C? Can anyone tell me which one do you think we have a more chances of getting lifestyle disorder? Hello, hello.
Hello.
Yeah, sorry. Am I not audible?
No, you're audible, sir.
No, you are audible. We are just thinking.
Okay. Just give your thought process, the difference between the visceral fat, subcutaneous fat, which I have just now told you. Tell me which one do you think will have a much more possibility of getting a diabetes or a cholesterol issue or anything?
I think C.
Someone mentioned C. Guys, quickly. There is nothing called right or wrong answer. I'll explain. I'm here to explain only. Just tell me what do you think.
It must be A.
Who is saying A? Can you please tell me one line? Why do you think it's A? And someone mentioned C as well. Why do you think C? Just tell me so that at least I know ना कि we are on the right path और मेरे को कुछ और explain करना है या फिर या कुछ understanding में भी gap आ रहा है. Please tell me. Guys, quickly.
I mean, here the visceral fat is more, right? I mean, that's what I interpreted, because that will probably act as, that will actually lead to metabolic disturbance.
Hmm.
That's my
Okay.
understanding.
Okay. And someone mentioned C also. Why do you think it's C?
सर visceral fat and दोनों का फेट का रेशियो मेरे को ज्यादा लग रहा था वो ये में, इसीलिए मैंने बोला.
Okay. Just give me a second. I think there is some noise issue which is coming up. Not some network issue. What happened? My system. Can you guys hear me? Hello.
Yes sir,
Hear
yes.
you, but
Yes.
I think that
Yes.
network issue तो hang हो जा रहा है.
हाँ मेरा जो है ना सिस्टम हैंग हो गया.
And maybe because that's the reason the video is not coming.
हाँ वो just give me a second guys.
Now it is back.
It's working.
नहीं
Yeah.
आ रहा है
But
सर.
there is a lag in the image. That's fine. But your voice is clear.
मुझे लगा उस पिक्चर में विसरल पेट पूरी जगह फैला हुआ है सर.
ठीक है अभी 1 मिनट रुको मैं बताता हूँ क्या हो रहा है. I think I'm back right now. I think so. Mitesh said as visceral fat will disturb the function of organs. Vishal is saying visceral fat is close to organs, so metabolism becomes sluggish. Okay, fine. So see, the one which is basically the A is something which is your the problem area. Okay, Why we are calling A as the one which will lead to the metabolic disorders more? Because if you look at that particular image, the visceral fat is actually very high. Does not mean that the one which is basically the C that cannot have the problem which has more visceral fat as well as the subcutaneous fat. But if you look at the ratio and if you look as per the studies which have shown that the visceral fat is one which is more responsible for the entire problem. So it's the A image which is basically causing the more issue compared to the B or C. Why? Because the visceral fat is more. Now, how do we decide that I should be storing more of a visceral fat and more of a subcutaneous fat and less of a visceral fat? But sorry, that is nothing under our control. Okay, that is something which is not under our control, or there is nothing you can do to basically stop this unless and until you change your lifestyle. Okay, that's why we are talking a lot about the lifestyle disorders, because I cannot decide that my fat should be stored within my subcutaneous areas and not in my visceral areas. Okay, or I cannot decide that my body should respond in a certain way. That is something which is basically your inbuilt. That is something which is naturally happening inside your body. It depends upon your body's tendency as well. Okay, so you cannot decide, you cannot do anything about it, you cannot even test. But yes, there is one simple test usually is your waist circumference. Waist circumference is something a very important parameter. Why we called a waist circumference as a important parameter, or a waist hip ratio as well we take it. Reason being, if your waist size is increasing more, there is a very high chances that you have a higher amount of visceral fat in your body, and that is why all your issues are happening. Okay, this is something which is a common parameter which has been seen in the multiple studies, where they have seen that the participants who have more of a waist circumference or their waist hip ratio is on a higher side, there are very high chances that they have more of a visceral fat and their health markers are basically not in the right range. Because why? Again, waist circumference, it's the abdominal area. It's the abdominal adiposity. If you link it, you will understand that why we are talking about the waist hip ratio or a waist circumference. Okay. Everyone clear till here?
Yes, sir. Sir, I have a one question.
Yes.
सर हम जब लाइफस्टाइल को सही करेंगे, डाइट को सही करेंगे, एक्सरसाइज भी करेंगे, उसके बाद हमारा कौन सा पेट जल्दी से जाएगा, या दोनों में से जाएगा, या
हाँ, so see, so I was coming to this part after this. See, our body is basically a natural fighter. Okay, whenever you start losing on your fat, okay, anyone who is basically currently right now, maybe for example preparing for an ICN or maybe preparing for any shoot or anything, you will be able to relate to this thing. Okay, see, whenever you start losing your fat, you will always see that your body is reducing in size. Okay, but you are still not able to see your abs. Okay, just quickly tell me, what do you think, which is the fat which is covering your abdominal muscles, your abs area? Above your abs area, what is the fat which is there? It's visceral fat or subcutaneous fat?
Subcutaneous.
Sir, I think it is the both.
Sorry? It's a subcutaneous or a visceral fat?
Sir, is it the both?
No, it's not the both. Shalu, how can it be a visceral fat? Where are your organs outside your abdominal area? I'm abdominal area in a simple layman terms. I'm talking about the abs. I'm talking about the abs. Where are the organs over here? How is it the visceral fat, Shalu? Everyone is clear on this thing that it's the subcutaneous fat and not the visceral fat?
Yes.
Yes, sir.
yes, sir.
It is between my skin and my abdominal muscles, right? Now, whenever you start losing on fat, or anyone who has basically gone into the journey of making, going into a lower body fat percentage, do you see your abs first, or do you just see your stomach going inside, and then at the later stages you see your abdominal muscles?
Stomach going inside, then yes.
Firstly, the stomach will go inside. Later on the lower body fat percentage, it would then the abdominal abs would be visible.
Visible, exactly. So we basically first of all see that my stomach is going inside. Okay, my abs are not clear. My abs, I cannot see my six-pack abs, but my stomach is going inside. I'm trying to explain in a very simple, relatable thing which you guys might have experienced or might be seeing someone else's journey. So you see that the body's abdominal waist circumference is first of all reducing. And after, in the later stages, when you reduce more further body fat percentage, your abs are visible. Why it is happening? Because first of all, your body tends to lose your visceral fat. Your body has a tendency to basically act as a fighter, and something which is not healthy for you, it start trying to remove it from your body. So body start losing on your visceral fat. It will lose your subcutaneous fat as well. There is nothing called, see, whatever we talk about now, we talk about majority, we not talk about कि 100% ये ही होगा, ठीक है, कि नहीं visceral fat ही जाएगा सिर्फ. There will be a loss of subcutaneous fat as well, but your body tends to lose more of a visceral fat because it has to bring your health markers under control. It has to bring your basically your health under control. Okay, and then they will start utilizing more of your subcutaneous fat as well, and then start reducing your body fat percentage gradually. Okay, so to answer your question, it's the visceral fat generally which shows more positive changes. That's why when you start losing on your weight, when you start losing on your inches, when you start losing on your body fat, you always see the improvement in the health markers. In the initial, we will talk about this thing in detail in later sessions as well. But multiple studies have shown this thing, that when you lose 5 to 10% of your current body weight, okay, some studies talk about 10%, some studies talk about 7%, but yes, majority of the studies have shown this thing, that when you lose 5 to 10% of your current body weight, okay, you will always see improvement in your health markers. You will always see the improvement, that your diabetes level are better than before, your cholesterol levels are better than before. It depends upon how severe they are, but they will always come under control. Okay, I think everyone is clear till here. Okay, now coming to that particular term which we were talking about in the starting. Now I'll expect you guys to let me explain this a little bit, that what this is. Metabolically obese, healthy individuals. Now quickly tell me, what do you think, what does this mean? What could be the possible meaning of this particular term? Metabolically, that person is obese. Okay, that person is obese as per the BMI, as per the scale, as per everything, but metabolically healthy. Why do you think this is happening?
Maybe because of muscle mass,
No, Harbaz.
more muscle mass.
No.
Because of the three criteria that we were saying, the HDL, triglycerides, and sugar levels are, if they're in good range, then they say
Oh.
that your
No.
metabolic health is good.
No. Just stick your discussion to visceral fat and subcutaneous fat.
So
Don't
visceral
go
fat
into
कम
muscle
होगा.
fat. No.
So
Sorry.
visceral fat उनका कम होगा. Maybe that's why metabolic.
Exactly. Visceral fat कम है इसलिए. Okay. मैंने अभी क्या बोला? What did I tell you? कि visceral fat और subcutaneous fat में we cannot control. We cannot control कि visceral fat या subcutaneous fat में body कहाँ पे जाके क्या store करेगी. ठीक है? There are people who have a higher tendency to store a lot of subcutaneous fat. I have a client range from 120, 130 kgs to 150 kgs to 190 kgs as well. And trust me, fortunately, those people have absolutely healthy, good markers. Okay, there is no issue, nothing. Okay, fortunately, they don't have anything because their body has more of a subcutaneous fat. Those are the people fall under these categories. But again comes with a but, that does not mean that they cannot have any other issues. Obviously, arthritis is something which can happen. Okay, GRD is something which can happen. Any other issues which you have studied can happen. But at least their basic health markers, which is your sugar, your cholesterol, your thyroid, which we generally relate it to a person who is on a higher side of the weighing scale, they do not have those problems. Why? Because that's how their body is responding. That's how their body is storing the fat. They're storing more into the subcutaneous fat rather than the visceral fat. Okay, that's why they are obese, but they are metabolically healthy. Metabolically means their health markers are in a good range. That's why it does not mean that if a person is obese, he will for sure have the issues. Okay. Coming to the second term which we studied in the starting. Metabolically healthy, obese. What does this mean? What do you guys think? What does this mean? That the person is basically healthy as per the definitions, but that person is metabolically obese. Why do you think what is happening over here?
इसमें visceral
So
fat इसका
visceral
ज्यादा
fat
होगा,
is high here,
high, and the other fat is low.
and the blood markers are also not so good.
Yes. So what is happening over here? In that particular, this is a person who is technically lean. A case where I am talking about a person. Sorry, I wanted to share few of the stories here, but I couldn't get the permission from my client, so I was not able to share the photos. Okay, but I'll see if I can share in some of the sessions. I have to take permission from my client before sharing any of the photos over here. Okay, so a person basically within the weight range of 55 kgs, but that person's body is basically responding in a way that he is storing more of a visceral fat rather than subcutaneous fat. So you'll not find that person obese. According to you, that person is basically cannot have any of the issues. But HbA1c is more than 14. Uncontrolled diabetes. Why? Because in these people, what happens? Unless and until there is a symptom which is kicking in, and they visit to the doctor, they cannot even imagine that they have the sugar or a cholesterol issue. And it's very common. I have a client with me, 68 kgs, 5'7" height, absolutely looking healthy. Has to move to UK for further studies. Got his routine blood test done. Fasting sugar was more than 500. Fasting sugar was more than 500. HbA1c was more than 14, and he did not have any of the symptoms. And there was no answer to the doctors as well, and they mentioned that okay, it might be because of only this thing that your body is storing more of a visceral fat. We lost few kgs, we made some changes in the routine, we started staying active, we got the HbA1c below 6, but it took us some 6 to 8 months because obviously it was an uncontrolled diabetes. So again, coming to that particular term, metabolically healthy obese. This is the reason which I always say that get your blood test done every 6 months or 1 year, even if you do not have any medical issues, because you do not know what is happening inside the body. Everything which is happening is basically you're seeing it from the outside, but you cannot imagine what is happening inside the body. That's why get your blood test done every 6 to 12 months. If the markers are not in range, get it done every 3 months. If your markers are absolutely good, still get it every 6 to at least once in a year, definitely, so that you can understand that what is changing inside the body. Because people who get these kind of numbers, HbA1c more than 14 and sugar level more than 400, 500, they are the one who does not got it overnight. It took some time to reach over there. And that's why they have such a high numbers. Okay. Everyone clear till here that why we are talking about these two terms, visceral fat and subcutaneous fat? What is the significance?
Yes, sir.
Yes, sir.
Okay, perfect. So guys, this was the session today, okay, about the obesity and lifestyle disorders, how obesity is affecting. I wanted to make you guys understand about the visceral fat and subcutaneous fat. In the next session, what we will be talking about is your BMR, your TD, very basic terms, which we which we have been seeing on the fitter on everyday basis. But I have a different way of explaining things so that at least it becomes it basically vibes well into your mind that why these things are important and what is the actual meaning. So there is no confusion left, because I want to touch base upon the diet part later. And before I explain BMR and TD and what is calorie in, calorie out, or the macros kya hota hai, I won't be able to explain how to get into the diet chart, what is glycemic load, glycemic index. Many people have doubt about these things, that we need to touch base upon the what kind of a diet I should be taking, but I will go step by step so that at least there is no confusion. So in the next session, I will be talking a lot about the BMR, TD, calories, macros, micros. ये छोटे-छोटे topic touch करेंगे जिससे at least base बनेगा, and then we will get to the diet part, and then we will get to the little bit about the management, that what all things you can do on your own to make sure that the health markers are within range. Okay. Yashika, can you please include leptin as well, leptin resistance? Sure, Yashika. Next session में maybe or for 5 minutes or something I'll talk about this thing. अभी करूँगा तो बहुत ज़्यादा जो है ना हेवाई चल जाएगा. For the people for whom this term is new, leptin and ghrelin are basically two hunger hormones which our body produce. Leptin is something which is basically my body is producing to suppress my hunger. Whenever my fat cells have enough amount of fat and they have the energy, they release leptin, okay, to send a signal to my brain that was enough of food, now stop eating. Ghrelin is opposite of that. Ghrelin is something when my body does not have food, my cells are basically depriving of energy. They send a signal to the brain via ghrelin that okay boss, you need to start eating something, we are deprived of energy. So those are the two hormones, but leptin resistance is something I'll touch base upon in a next session. Okay guys, any other doubt in today's topic, anything which I missed which you think should have covered related to obesity, anything?
Sir, can I ask something?
Yes sir.
सर एक्चुअली अगर एक लेडी का 5 फुट 2 इंच हो और वेट भी 50 हो और कहीं पर भी ऐसा नहीं कि स्टोमक बार आया है, कुछ भी है, लेकिन तो उनको अगर एसिडिटी का प्रॉब्लम रहता है तो उनको और भी फैट लॉस करना चाहिए क्या?
It does not mean कि fat loss की वजह से acidity है. Acidity is a problem which can be because of multiple issues. As I mentioned, it's not something कि जो चीजें मैंने लिखी थी वो सिर्फ obesity से होती है. Like GERD जो मैंने लिखा है acid reflux का, वो जरूरी नहीं है सिर्फ obesity से. Obesity can lead to it, but there are multiple other factors also which can lead to GERD. We need to see if obviously obesity is not one of the cause, then what is the cause? We need to find out the root cause. अगर obesity root cause होगा तो वो obesity से ठीक होगा. But if there is anything else which is happening, people get acid reflux because of caffeine as well. People get acid reflux because of eating huge meals in a single sitting. People get acid reflux because of small time gap. It can be because of your particular food allergy or food intolerance as well. There are multiple reasons. So you need to see what is the reason. Okay, it does not mean obesity.
उनका एक्चुअली सॉरी मैं और एक पार्ट बोलना भूल गया, तो कोलेस्ट्रॉल भी इशू है इसलिए मेरे को लगा.
Again, still it does not mean that it can be because of obesity.
Okay.
Does not mean. Can be any other reason as well. Can be because of the fat as well. Can be any other reason. There is no short thing.
Okay. Got your point. Thank you for
Yes,
your wonderful session.
Sure. Thank you. Guys, any other doubt, any other issue in the today's topic? Anything I missed upon or anything you want to discuss?
No, sir.
No questions. Very good. Thank you so much.
Perfect. Thank you so much, Words. Thank you so much for coordinating everything. Okay, perfect. So we'll meet next week again between 1 to 2. We'll be talking about the basics. That will be a very base. That session will be, even if you know about the BMR-TD and I can show you this thing, your thought process will change once I'll teach you the way I basically teach to my students or my other clients. Okay, but okay. See you guys next week. Thank you so much for joining on Sunday and have a great weekend. Yes.
Thank
Thank you,
Sir,
Dr.
actually,
Akash.
one of my friends, she's in Australia, but she is not a Fitter member. She doesn't have an account on Facebook. Can she also join this?
Yes,
Seminar
definitely. Just send the registration link to her, and when we are sending the joining link, we'll send it to her as well.
All right. Thank you, sir.
Yeah. Yes, Payal, I'll upload the video on the YouTube, and it will be there on my social media channels, so you can take it from there.
Thank you, sir.
Okay, sure. Okay, thank you everyone. Thank you so much for joining. Have a good Sunday. Bye bye.
Good day.